GrandCare Assisted Living Services, Assisted Living Waiver, everything you need to know. Step 1. Apply. Request an application packet from our GrandCare ALW team. We are happy to provide our application packet via email, fax, or have it mailed to your doorstep. Submit your application form to our GrandCare ALW office team by email or fax. Our email is alw@grandcarehealth.com, and our fax number is 877-405-6991. Our office address is GrandCare Assisted Living Services, 3452 East Foothill Boulevard, Suite 130, Pasadena, California, 91107. To qualify, applicants must meet the following criteria to be eligible for the Assisted Living Waiver program. Eligibility requirements include: you must have active Medi-Cal Benefits, must have active income benefits such as SSP, SSI, or SSD, you must be 21 years of age or older, and must meet ALW Care Criteria. There are 3 types of applicants: a community applicant, rollover applicant, and skilled nursing facility applicant. Community applicants. Community applicants are individuals currently residing at home, in a house, apartment, senior housing, or shelters. In some cases, homeless participants where they have a community liaison. As a community applicant, we will require our application form to submit a waitlist request to the Department of Healthcare Services, DHCS. Once released from the waitlist, we will work together to obtain additional documentation needed. Rollover applicants. Rollover applicants are individuals that are already receiving care and assistance, currently residing in an assisted living facility, such as a residential care facility for the elderly, RCFE, or a boarding care home, BNC. Rollover applicants have the same process of a community applicant. However, a rollover applicant will require an appraisal form when first admitted to their facility and an updated appraisal at the time of the assessment. Skilled nursing facility applicants. SNF applicants are individuals currently in a skilled nursing facility or hospital. To qualify as a SNF applicant must have been institutionalized for at least 60 days, and we must conduct our initial assessment before discharged. If you or a loved one are considered a SNF applicant, please contact a GrandCare ALW team member to provide you with our SNF Fast Track checklist immediately, as we require specific documentation to conduct assessment. Step 2. Community and rollover applicants only. The Department of Healthcare Services, DHCS, has an active waitlist for the ALW program. Current waitlist time is averaging around 6 to 12 months. This timeline is subject to change monthly. The waitlist time is the same for every ALW Care Coordination Agency, CCA. Fortunately, it can change, and you will hopefully be released from the waitlist sooner than expected. Please contact a GrandCare ALW administrator for updated waitlist times. Waitlist release. One of our GrandCare ALW team members will be contacting you throughout this waitlist period and notify you of the upcoming release. Our team will email you the documentation required prior to the waitlist release so you and your loved ones are prepared and the initial assessment can be done promptly upon waitlist release. Step 3. Initial assessment. Once you are released from the waitlist, one of our RN care coordinators will contact you to schedule the initial assessment. We have 60 days from the waitlist release date to submit the assessment to DHCS for ALW approval. Our experienced RN care coordinators will work with your schedule to coordinate an in-person or virtual assessment to determine your medical ALW eligibility. The DHCS ALW assessment tool will evaluate your care level based on current medications prescribed, recent diagnosis, medical history, and thoroughly review all of your care needs. DHCS Assessment Tool. The Department of Healthcare Services approved assessment tool will generate a tier level based on your care requirements. The DHCS assessment tool evaluates cognitive, mood, and behavior patterns, physical functioning, communication, hearing and vision patterns, diagnosis, medications, nutritional status, and skin condition. There are 5 tier levels of care. Once the assessment tool is completed, it will generate a tier level of care. There are 4 tier levels of care, tiers 1 through 4, and a tier 5 by RN request if participant meets specific care criteria for traumatic brain injury TBI requirements. Light to moderate care generates a lower tier level as opposed to extensive to maximum care, which will generate a higher tier level. Step 4, review and approval. Once all documentation is submitted to our team and an RN care coordinator has completed the initial assessment, our social services department will review and submit the complete initial assessment packet to DHCS for approval. Our GrandCare ALW team will notify you as soon as the initial assessment has been submitted to DHCS for review. We should receive the approval within around 45 days of the initial assessment submission date. During this time, please review the DHCS list of ALW Approved Facilities. Step 5, approval to transition. Once DHCS has approved your initial assessment, we will then receive the approval to transition into an ALW Approved Facility. Once DHCS has approved your assessment, we can begin working on finding you or your loved ones a safe and comfortable new space to begin your next chapter in life. We service most counties in Southern California. Our experienced and professional team work with over 500 ALW approved facilities to secure placement at your ALW facility of choice. We work with over 500 ALW approved facilities in most Southern California counties. This includes Los Angeles, Orange, San Bernardino, Riverside, San Diego, and will be coming soon to Kern County. Get the care you need. With over 500 facilities to choose from in Southern California, our team will work with you and your loved ones to make sure we secure placement at an ALW-approved facility that can accommodate and provide the care you need. Most ALW-approved facilities provide care and assistance for individuals with disabilities, mobility issues, or cognitive impairment that happens with aging. Memory care for those diagnosed with Alzheimer's or dementia. Some specialize in care for those with traumatic brain injuries. And others also offer mental health assistance. Secure placement. Once you have 5 to 10 facilities in mind, our GrandCare ALW placement team will provide these facilities with the necessary records and the DHCS approval for them to review. This is to ensure the ALW facility will be able to accommodate the care need requirements of the participant. Once the ALW facility has completed their preliminary review, they will then contact ALW participant or legal representative to coordinate their own in-person assessment. During their assessment, they will get to speak directly with the ALW participant or legal representative to determine if they are a good fit for their community. If the facility decides to admit the participant, they will contact you to sign and complete the admissions agreement as well as determine a move-in date. Keep in mind, larger ALW assisted living communities prefer to accept tier levels 1, 2, and 3, and some can accommodate tier level 4 as well. Smaller ALW assisted living communities such as board and care homes, which are a more home-like intimate setting, prefer to accept tier levels 4 and 5, and sometimes tier level 3. ALW room and board monthly rate will be required upon move-in, and required on the first of every month moving forward. The current ALW room and board rate is $1,398.07 per month. Without utilizing this assisted living waiver program, assisted living costs on average around $5,900 per month. We understand some individuals receive under $800 a month in Social Security benefits, but don't worry. Our team will provide you with the tools necessary to increase your Social Security income to meet your ALW room and board monthly rate after move-in. ALW room and board rate. The ALW facility will be able to utilize the Assisted Living Waiver to bill Medi-Cal directly for all care provided to the ALW participant. Meaning, participating in the ALW program, Medi-Cal will be covering most of the cost, providing between $2,500 to $4,988 in savings per month. As an ALW participant, you will only be required to pay $1,398.07 per month for room and board, as Medi-Cal will cover the rest. Your ALW room and board rate of $1,398.07 per month will ensure that you receive all assistance with activities of daily living and instrumental activities of daily living, medication management, recreational activities, provides 3 meals a day plus snacks, performing all necessary housekeeping tasks and laundry, transportation, and more. Step 6. ALW Enrollment. Once you move in, our team will submit the enrollment request to DHCS to finalize the enrollment for the Assisted Living Waiver. ALW enrollment will be effective as of your move-in date for community or SNF applicants. ALW enrollment will be effective as of the pending approval date for rollover applicants. Be advised, Medi-Cal Benefits must reflect a waiver-appropriate aid code with a zero share of cost to submit ALW enrollment to DHCS. We will provide you with the information necessary to have aid code changed if needed. Once move-in is confirmed, our team will submit enrollment to DHCS as of move-in date. DHCS will then finalize the ALW enrollment and provide us with the informing notice, usually within 14 to 21 days of the enrollment request submission date. ALW enrollment complete. As your care coordination agency, we will continue to monitor and oversee participants' care throughout their enrollment. One of our RN care coordinators or someone from our social services department will visit on a monthly basis to check in and ensure participants are receiving adequate care at the facility. We will also conduct a reassessment every 6 months to reevaluate health and care level needed. If you have any questions about the enrollment process, please refer to your application packet or contact us for additional information. Our phone number is 877-405-6990 or email us at alw@grandcarehealth.com. Our office hours are Monday through Friday, 8 a.m. to 5 p.m., excluding major holidays. Visit our website, grandcarehealth.com/ALW. You may also find more information on our Facebook page or Instagram. We look forward to working with you and your loved ones.